Hello, everyone, and welcome to Insurers of Tennessee's webinar on returning to work. We are joined today by Claudia St. John, who is the president of Affinity HR Group. Claudia and Affinity HR have been working hand in hand with Big I, and Claudia is joining us today to answer your questions on returning to work under the new orders and the new normal. We also have on the phone with us Jim Lehman, our very own Director of Government Affairs, who has been very involved with not only working with the chamber, but with keeping up with our local and state orders and where we are in the process. So jumping right into it, I thought I would start with a couple of questions on workplace safety and PPE. So Claudia, we have been getting questions from members about PPE and going back to work and being safe, etc. The first question we had is, does a business have to limit their staff based upon the square footage of their office?
So when this initially rolled out, when we all were sort of progressively locked down, and I'm speaking nationally, not specifically to Tennessee, I don't exactly know how it rolled out for you in Tennessee. Initially, the county said you need to reduce your workforce by 50% and then by 70%, 75%, and then they just shut it all down. Those orders to stay at home and the opposite of those orders to open back up are really local ordinances that have been specified by your governmental agencies, whether those are counties or regional authorities, city authorities, or your state. What I have seen have not been square footage basis in order to determine how people should go forward. As we've seen it generally, as I've seen it generally, it's a percentage of workforce. So you may bring 20% of your workforce back or 50% of your workforce back. That really has been, from what I can tell, irrespective of square footage. But of course, I think one of the things, and we were huddling a little bit before we got on the call, is that as you're preparing to re-enter and to bring folks back if they have been home during this time, it's to look and see how much distance you can provide to folks in your space. And if you can bring some folks back and leave some folks home and maintain the fairly healthy distance, that's always going to be the best decision until we have some way of defending ourselves physically in any other manner from this virus. So I would encourage folks, and this is maybe a little far afield, but I would encourage folks to start looking at their workplace. If they don't have partitions between your desks, throw up some sort of plexiglass or barrier. You have a big conference room, well, you're not all going to be in that room anymore. Put one or two people in there with appropriate barriers to separate folks out. You have a big utility closet, use that as an office, just to create the physical space enough to distance if you can. So when we think about square footage, it depends on how that square footage is laid out. And if all the desks are in one place and you've got a reception in the other, move it around so that you create enough space within the physical proximity of your workplace. And if you can, I'm going to be a broken record on this the whole time. If you can keep people home, keep people home. For right now, it maintains the only way that we can protect ourselves from this virus is social distancing, good hygiene, and really using appropriate protective equipment.
Okay, good ideas. Another question we've received is, does an employer have to medically test employees? Are they required to test employees before they return to work? And if they don't, is there a risk of negligence claims?
So that's a really interesting question. And actually, the flip side is true. The Equal Employment Opportunity Commission, the EEOC, has said that you can take the temperatures of employees before they come to work. The CDC has a different opinion on that. You can, but you can't actually require employees be tested, except under certain circumstances. Because the EEOC determines that a COVID test is actually a medical procedure, and you cannot require an employee take a medical procedure. That said, if you have an employee who has COVID and tested positive for COVID and went out, the CDC is saying that they should not be allowed back until they've had 2 consecutive tests at least 24 hours apart after they've healed from all the other, after they've met all the other standards that they have to. So, no, you actually shouldn't be testing employees unless you operate a facility like a skilled nursing home or something like that that requires something different. And I can't envision that an insurance agency would qualify for that. You can do the test, you can do the fever checking. That seems to make people feel better. It seems to make people feel like you're doing something. It's wholly ineffective at really doing much because, you know, 50% of people with this virus don't have any symptoms, and those that have temperatures can reduce them with fever reducers. So it's a feel-good measure, and you're certainly able to do that. And your employees may appreciate that you are doing that. Just know that it's not what you should be relying on to ensure that you don't have an infection.
So a similar question, I have heard or read that employers should be asking, I guess I don't say background questions, but, you know, who have you been around? Who have you seen? Is that something that's required? And does the employee have to answer it?
So again, this is really interesting. You may, unlike normal HIPAA requirements, which means you can't ask that stuff, you can actually ask if they have had any symptoms of COVID and if they have been exposed to anybody who's had symptoms of COVID, and you can ask them that, and you can have that reported to you. You can record that. Some states like Ohio and some counties in Michigan have had mandatory temperature checking and asking those questions. So what's funny is that CDC says don't bother because it's not going to do anything, but then you have these local ordinances that vary. So I would really check locally to see what those requirements are. It's one of the weird circumstances here that there's no consistency. There's even no consistency between you know these temperature checks and some of these state orders. So yes, you can ask those questions. The thing that you have to do in keeping with HIPAA in terms of you know, health privacy is if somebody does get sick, you should not tell other employees who that is.
Interesting.
You should maintain that privacy. You should not report out anybody's symptoms, so you want to keep that information as private as you can with, you know, just those who need to know. And if you've made special arrangements for employees because of underlying health conditions, you know, maybe they have autoimmune or maybe they have some basis for needing additional protection and then staying home from work, for example, you need to keep those underlying medical conditions and those decisions to yourself, really.
Good information. What about PPE? Should employers require, like take the situation of an insurance agency, should employers require employees to wear masks? Do they have to provide them? And then what about the public coming into an office? Do they have to provide PPE to the public?
So again, I'm going to sound like a broken record on this. It really depends on where you are. In New York State, we are not allowed out in public without masks. I live in Syracuse. I live in the middle of nowhere, but I'm not allowed to go to my grocery store or any public place without a mask on. So in certain places, yes, you have to wear masks and you have to require them. I have not seen any instance where an agency would need to require that employees wear masks. And I suspect there aren't a lot of mandates of that nature. My good HR hat tells me, however, that if you are bringing people back to the office, have them wear masks. Those agency spaces tend to be smaller. You tend to be in closer proximity to one another. My recommendation is to, as an owner and therefore as employees, you should all pretend like you have COVID and assume that you have COVID and can share it and spread it to everybody you're going to be in contact with, and protect yourself by covering your mouth and washing your hands appropriately. So I'm saying wear masks. I don't know what the harm is. I say wear them, and I want to get one that has a big smiley face, like all these big teethy smiley faces. In terms of providing it, I think if you're bringing employees home, back from home, you're bringing employees into your agency, you should know that that's scary. And they're putting themselves at risk, and they're putting their families at risk for you to do that. So I would provide it. The question is, where do you find it? And I will tell you here, my promotional products company, the folks that do like my logo and back and my business cards and my swag and this is hand sanitizer. I got it from them. I couldn't get it at the store. I couldn't get it at the pharmacy. I couldn't get it anywhere, but I got it from my promotional products company. So all of the guys who were typically making swag for you, they are now importing, selling, and branding face masks, detergent, protective gear. So that's a great source. If you can't find it through any other means, I would encourage you to go to your promotional products companies, what PPE they have available. And if you order stuff, ask them first whether or not they have it on stock or whether they're importing it. You want them to have it in their back office because importing is not easy these days.
Yeah. Locally, our distilleries have started making it, so there's always that. Yeah.
It used to be my favorite bourbon provider. I can't drink the bourbon. Now I can,
but you use the hand sanitizer, exactly. And then finally on cleaning, I believe the CDC and both OSHA, am I correct, have released cleaning guidance?
Yes.
And then Jim, has Tennessee released different guidance on cleaning, or are they just referencing folks to the CDC cleaning guidance?
So that's a good question, Ashley. It's interesting because a lot of the guidance from Tennessee mentions the CDC guidance and guidelines on cleaning, and then they'll have their own home cleaning guidance as well. So it's not clear. They don't say when that may or may not be consistent with the CDC guidelines, and which if there was any sort of contradiction between the two, which to follow. That being said, all the things that we have seen from the state have been really just guidance, like you said. Nothing, even as much as Claudia mentioned, is requiring a mask when you leave your home or that kind of thing. In Tennessee, it's been a lot more guidance and that kind of thing. So.
Okay, so there's no like minimum set of standards in Tennessee right now that you have to do this or you have to do that in order to reopen, other than obviously in restaurants and things, they've got the 50% and the spacing requirements.
Right. So as far as minimum standards in general for businesses to reopen, what we have seen all along is that, beginning back with the orders from the governor originally shutting down non-essential businesses and that kind of thing, only the broad things are orders. So businesses that are non-essential, must not operate to the public. Things like restaurants weren't allowed to operate, and now most of them are allowed to operate at 50% capacity. So that would be an actual order from the government and not a suggestion. Things like nursing homes not being allowed to require visitors, those were orders, and there's a few more like that. But for insurance agencies, they have always been deemed essential, so they've always been allowed to be open. So their reopening process is one more of reopening based on guidance and guidelines than one based on orders from the governor's office. That said, there are a lot of helpful guidelines from the governor's office. There's set up a website called the Tennessee Pledge, and they have industry-specific guidelines. So things like retail, restaurants, construction sites, and then really for our folks, there is an office building guideline. There's a general business guidelines, and then maybe to a certain extent those retail guidelines if folks have customers in their office a lot and need to do that. Those guidelines suggest a number of things, some of the things that Claudia was talking about. So again, those are suggestions or guidelines, but things like screening employees before they come to work by asking them if they've been feeling well the last few days, screening for temperature, asking if they've been in close contact with someone that's been diagnosed with COVID-19. And then there's a number of, physical social distancing guidance in that Tennessee Pledge document as well. Things like trying to, if there's a meeting of more than 3 or 4 people, limiting the space in a room of people meeting, keeping physical distance between employees to the maximum possible. Also things like considering modified work schedules and shifts. The list really goes on and on, but again, those are all guidelines. And so the question for our folks really isn't more of, hey, am I violating the law? It's that liability question that you mentioned. What is my exposure if I am not able to follow this guideline to a T, or my business doesn't allow for it, or we simply, we're trying everything we can, but we didn't ask this employee, whether or not they had any symptoms the day before they came in. So, and I think we'll talk a little bit more about that later, but that's sort of the bigger question is, what kind of exposure do I have if I'm not able to follow those guidelines?
Okay. And then
Actually,
Jim,
before we move off on that question, I just wanted to add one other piece to it, and everything that Jim has said is absolutely spot on, and what we see. These are all standards, right? They're not requirements. And you can do all of them and still end up with a claim of liability. You can do none of them and never end up with a claim of liability. And none of that will determine whether or not you're successful or not successful in defending that claim. We're in a no man's land. None of us have been here before, so we're all just figuring it out. But I think from the perspective of an agency that's either opening up or that's bringing folks back, or that's really, they've been operational, so however they're doing it, this question of PPE and this question of cleaning, and OSHA and EEOC guidelines and Department of Labor guidelines and CDC guidelines. One excellent source for agencies is to contact a cleaning company, a professional office cleaning company. And if you don't have one already, establish a relationship with one. And your employees will appreciate you coming in and doing a deep clean of the office space. Everybody will appreciate that. That is chicken soup of the highest degree. It also shows that you've tried to keep your place clean, but it does something else. And that is, if you get an infection, if you have an employee or customer who comes in and later tests positive for it, they'll know your space and they'll be able to come in with very short lead time and very little prep to come in and do an appropriate remediation. So we've been recommending all of these agencies that may not have a professional cleaning crew. They may hire, Sue down the street to come in and clean their office a few times a week. They may want to just establish a relationship and do an initial clean with a professional cleaning company in order to at least have established those connections. And they may also be good sources of purchasing the appropriate equipment for cleaning your offices. And one of the pieces on that, we see a lot of companies are relying on antibacterials, antibacterial soap, and antibacterial spray. This is a virus. It's not a bacteria. So those are not sufficient treatments for this. So the OSHA has also put out a number, and the I forget the federal agency, on what chemicals to use. So those cleaning companies will also know the right product for the job. And so if you don't already have that relationship, now's a great time to establish it.
That's a good point.
Actually, I wanted to mention one other resource too. I mentioned the chamber earlier. The Tennessee Chamber also has a healthy business certification that you can, they have classes online and through their website, where you can learn sort of, best industry practices for cleaning and those kind of things that Claudia was talking about, and get that certification as a healthy business.
That's great. Great to know. And it sounds like some of what I think the big message is understand that everybody is, like you said, this is new, this is an unknown, and everyone, your employees, the folks that are your clients, everyone is anxious right now. And so acknowledging that and doing the best you can to reassure within the limitations that you may have is kind of the big picture message, I think.
I think if you're cavalier and you don't do anything and you're like, it's fine, we're allowed to open up, we're good, that your employees are frightened and their families are frightened. They don't want their loved ones leaving their houses. You know, it's a scary time. So again, it may be chicken soup, but it's a good, if nothing else, it will give good peace of mind. And that also is a good defense should you face a negligence claim. We did these things. We don't know. There was, you know, we were just kind of flying blind, but we used every resource that we could find in order to maintain a healthy and clean workplace.
Yeah. Okay. So, Jim, another question we've gotten, in we've kind of talked a little bit about it, and Claudia just mentioned it, is could somebody be sued by one of their employees or by a client if they thought they were exposed in an agent's office?
Sure. So, I mean, kind of in general, anyone can be sued. The real question is, you know, whether an injured party is likely to prevail on a negligence claim, most likely, or other tort claim. What Claudia mentioned, the whole business community is frightened over the prospect of these claims because it's really kind of uncharted territory. You know, there hasn't been a global pandemic like this in 100 years. You know, back when the Spanish flu was around, there was a lot less litigious of a population than it is today. So people are concerned about facing that liability, and so a negligence claim consists of 4 elements, right? So if someone contracts the virus and sustains damage, they're going to argue that, you know, your business is what caused their damages. So the 4 elements of that is, you know, did the agency, the business, owe a duty to the injured party? Did they breach that duty that they owed? And then most importantly, probably for these cases, is did that breach of duty cause the injuries to the injured party? And then 4, you know, was there damages or harm? And obviously with this virus, you know, with a mortality rate of somewhere between 2 to 4%, and a high hospitalization rate, obviously there are a lot of damages out there. So that's of concern to the business community. But that causation element is going to be very difficult to prove. You know, if someone that's injured visited your business, but they visited dozens of other businesses or had visitors in the time frame with which they could have contracted the virus, it'll be difficult to prove that they contracted it at your business. Things like, you know, if you have 10 or 20 employees that all get it, you know, at your business, that could, you know, go a lot further in proving that at least they contracted the virus at your business. Now, whether or not they contracted it because you breached some sort of duty owed, you know, can still be tough to prove. You know, as Claudia said, you could really be minding your P's and Q's, following all the CDC guidelines and state and local guidelines, and still have someone contract the virus. Or you could, you know, do next to nothing and be lucky and not have someone contract the virus. So it's hard to prove that the employer's action or inaction is what led, you know, to someone contracting the virus. All of that said, it's certainly possible. A lot of states are looking at, you know, liability protection legislation to just kind of clear up how much exposure these businesses have, and that's being considered on the state level and also on the federal level. I know Mitch McConnell's been talking about that issue as well.
Good to know. Kind of along the same lines, but a little bit different, is we have gotten a lot of questions about workers' compensation claims and whether or not an employee who contracts COVID-19 is eligible to file a work comp claim. What are your thoughts on that, Jim?
So yeah, again, anyone could file a claim. You know, the question is whether or not that claim would be compensable. I do want to mention the NCCI website has a lot of great resources on FAQ, all these workers' comp questions. So I really recommend that you look there. But the answer to whether or not a claim would be compensable is maybe. Unfortunately, that's kind of the standard legal answer. But in general, workers' comp law provides compensation for occupational diseases. So diseases that arise out of and in the course of employment. And they do not provide compensation for sort of ordinary diseases of life, like the cold or flu or things like that. Now, there are going to be occupational groups most likely that will argue that they have a much higher probability of exposure to coronavirus, folks like healthcare workers and that kind of thing. But then there are others that will have a much harder time proving that this is an occupational disease. We haven't seen in Tennessee yet, and I'll check with the Bureau again here soon, but we haven't seen any cases that have been approved or that any of that have kind of worked their way through the workers' comp court system. So, still waiting to see on the ground results on that. And you may have seen some news articles in other states that are considering legal presumptions that an infection was work-related. Some of those states, it's for folks like healthcare workers or emergency responders and those kind of folks. But currently in Tennessee, there's no such presumption available here. So again, I would refer you to that NCCI page. And the chamber as well, they have a seminar by an employment attorney that answers several workers' comp questions too.
Excellent, thanks. And then I guess our last kind of section, if we want to section this off, is employee-specific questions for employers. Claudia, I'll kind of throw it back to you. We have gotten questions from folks who want to know when several different categories on the return to work, but for employees who are at higher risk for either their age or because of underlying medical conditions, if that employee wants to come back to work, can an employer refuse to let them return to work or delay their return because of these underlying conditions or because of their age?
So that's a terrific question. And, this is one of those areas where employers think they're doing the right thing, and then they make these determinations, and it turned out, no, that was not the right thing. And so what we recommend you do, if you are aware of or if you're made aware of the fact that an employee has an underlying health condition and wants to come back to work, we haven't seen that many of those. We've seen the opposite of that. But somebody who wants to come back to work, as an employer under the Americans with Disabilities Act, you are required to provide reasonable accommodation to those employees with disabilities or other underlying health conditions to help them satisfy their requirements at work given their healthcare status. So letting them work from home, allowing them to remote work would be is a really reasonable and perfect example of a reasonable accommodation. Making the employee do that, requiring that of an employee, perhaps against their will, could be viewed very easily as discriminatory because you're requiring a different standard of an employee than of somebody who doesn't share that health condition. So my advice is not to require anything. If you have an employee who wants to come to work, is willing to take that risk, you have that conversation, you document that conversation that you did want to offer this accommodation, talked through them with it, you made them aware of it, and just if despite that they want to come to work, I would let them come to work. I would not require that they not come to work. There's one other thing that we haven't talked about, and I just want to put it out there. In returning to work, it's really important that you as an employer are aware of the symptoms of COVID and that your employees know what those symptoms are. And the rule is, if you show any symptoms of COVID or if you had a close exposure to somebody who has symptoms of COVID, you should self-quarantine and stay home. And the thing that's important about that is that those symptoms are changing. Originally it was just a fever and a cough, and shortness of breath, and now it's that and diarrhea and loss of smell and loss of taste and purple toes, literally purple toes. and lots of other things. So as an employer, I would continually remind employees what those symptoms are, what to do if they have them, which includes staying home and calling their doctor.
Good advice. So let's say we are where we are today, and in Tennessee, certain businesses can begin to return to work, and you have an employee who is anxious about returning to work. They just also happen to be kind of a problem child. Can you use the return to work as an excuse to go ahead and take care of that problem employee by terminating them?
You know what, it's so funny with employers, there's always, I don't know why, but they're always looking for another way of terminating a problem employee, right? Like, we're changing up our job structure, we don't have that business need anymore, whatever. They're just using these oftentimes as ways of just not having to have that conversation and just getting rid of somebody. That's always the wrong choice. The right choice is always to say, look, we need team participation here. If you're not willing to come back to work, you don't want to come back to work, then this is not the right job or time for you. So if it's a problem employee, deal with the problem employee because of the problem that that employee faces. And if there was ever a time to maybe cut some of those types of employees out, it's this because of the expanded unemployment benefit that exists. I mean, granted, it's a terrible time to be unemployed, but if there was ever a soft cushion to land on, an added $600 per weekly benefit through the end of July is a pretty nice time. That doesn't, but are you going to ask me now about what to do if an employee doesn't want to come to work because they're not a problem employee, but because they're afraid?
Yes, that's next.
I get that question about 15 times a day. So, and it speaks to the fact that folks are afraid, that they legitimately are afraid. Unfortunately, there's not a lot of remedy for them. So even if they have an underlying health condition that would cause them to be in a very high risk situation, if their doctor says stay home because of your high risk, they would be eligible for federal reimbursement under the Emergency Paid Sick Leave Act. If a doctor says stay home, that'll give them 10 days. After that, it's whatever paid time off is available to them. After that, there really is nothing available to them other than a furlough or other than some form of being let go. So I think it's a lot of folks think, okay, well, maybe I could just furlough them and then they could collect unemployment and ride it out until this is better. But unemployment is a state program. So as an employer, you have no say over whether or not that employee is going to get those benefits. And given the crisis that all of these states are facing, if they check with that employee and ask if work was available to them, that they simply declined, and they answered yes to that. And then when they check in with you and they say, was work available to that employee, and you say yes to that, they won't qualify. So unfortunately, being afraid doesn't get you very far. You'd like to think you could get, short-term or long-term disability, but being afraid of being sick doesn't qualify you for those coverages. You actually have to be sick.
Okay.
So it's one of those holes. It's a tough situation. And that's when I recommend, if they can work from home, keep them home. Keep them gainfully employed in whatever way you can and keep them home.
I thought this was an interesting question, and I didn't really have a good answer for it. Now that businesses are beginning to open back up, if an employee's child's daycare, so we know that right now daycare is one of the reasons or lack thereof for someone to stay home and under the FFCRA. But so let's say the daycare is now open, but the employee is afraid to send the child back to daycare. Do they qualify under the 10-week FFCRA or I guess 12 total with the paid sick leave, or does that end once the daycare opens back up?
So this is a great question, and I've gotten this a lot because this is also happening now when we're coming to the end of the school term,
Mm-hmm.
and schools were closed down, so folks were home. But now that schools are closed down, what was your plan for the children after school?
Right.
So both of those are similar issues. Under the form that you're supposed to fill out to take this leave, you're supposed to certify that there was no other child care available to you and you had no other means of tending to that child. Now, they probably filled that out when they were in school and school was over. You should have another conversation with them now that the school term is coming to an end. What's their plan for after school? What were they going to do? And whatever they were going to do, is that still a viable option? So first of all, now is a good time to revisit those previously allowed family paid leave coverages. But like the previous situation we just talked about, if daycare is available to them and they're simply not required, they're afraid of going, I don't think that would cover under the Federal Paid Family Leave Act. And if you as an employer are a little lax on that, the issue is you will not get reimbursed by the federal government for extending that leave. So it's important for you to really look at this. Now, you can also be creative. So maybe that daycare is no longer is frightening. They don't want their child to go there. But what about the high school kids that are all home from school and have nothing to do? Maybe you as an agency can pay for the benefits for the hours of having the teenagers that are all sitting at home Zooming one another and, you know, playing on FaceTime. Get them to come in and watch your kids. So while they might not be eligible for federal leave, there may be other accommodations that you can make, because it's not unreasonable not to want to drop your kid off in a daycare in the middle of a global health pandemic. I think if I had a small child, I would feel that same way. So be creative about what other work arrangements are available, and it may not be for full time. It might be just, you know, in the morning and an afternoon, but if the baby sleeps, and they can work during nap time. So being flexible and being understanding. But to this basic question of whether that would be covered under the Federal Medical Leave Act, I do not think so, because that child care is available to them and they're just choosing not to use it.
Excellent, excellent. So I think this is the last question we had gotten, and we'll wrap it up with this and maybe some final comments from Jim and Claudia. But this is kind of, I guess, in the HR category right now. Obviously, employees are working from home or remote work, telework, whatever term you want to use. If for, let's say, the time being or the next 30 days, you are willing to allow your employees to continue working from home, but you eventually want them to come back to work. Do you, as an employer, are there any concerns to allowing folks to work from home right now, with the understanding that eventually there's going to be a time when everybody has to get back to the office? And do you have to address that in, a policy manual, an HR manual, or can you just, for the time being, because of the situation, kind of keep band-aiding this together?
I think we're still in Band-Aid mode. I still were thinking rubber bands and bubble gum. I
Yeah.
do. It's the safest option to keep them home now. You know, if they're not customer facing and they have access to your claims management system, they have access to all of that. Why bring them back? Think about why you want them back in the first place. I would say 9 times out of 10, keep them home. But you can also let them know we're rubber banding and bubble gumming it. And so when the time comes, I need you back. When the time comes, we assess that it's safe enough to bring you back, we're going to bring you back. So I think it's being straight up and honest with them that this is an evolving situation. We've never been here before. But I do think that we should not be afraid of imagining a future where we have more remote work. Because if you can be productive, and I think folks will find that people are amazingly productive when they work from home. You think they'd have way more distractions. Once they get into the groove, man, they do a good job. And if you do allow for remote work, you've expanded the pool of potential labor available to you. You can hire some incredibly experienced, customer service agents, producers, commercial, producers that are out there that are doing a really great job, may not be in your local community. So stay home if you can. Be considerate with those requests, and you can put together a policy. Policies make us all feel better, but right now this is like burn the policy. We're just doing whatever we can. That's kind of how we're rolling. Makes everybody nervous, but I don't see any other way around it.
Fantastic. Any last words, Claudia? Any thoughts, advice, suggestions as we wrap this up?
Yeah, I think my parting words are: coronavirus is still out there, and many of your locations don't have a lot of it. That doesn't mean that they won't have a lot of it. It doesn't take many people to get infected and come into your local community wherever you are, and to face this situation. So if you can keep them home, keep them home. Practice clean hygiene, doing all that stuff, covering your coughs, all that great stuff. But the last thing I want to say is there is a karmic weight that we are all dealing with right now. And none of us can plan. I mean, I can't plan beyond the fact that I need another cup of coffee. That's all I got. I can't plan next week. I got 2 kids who need to go to college. Will they? I don't know. Will one graduate from high school? I don't know. I don't know anything, and none of us do. And so that lack of security, of predictability, of certainty, while all of the institutions in our lives crumble around us and show that they're incapable of doing any of the things that we thought they were going to be able to do for us, we're all dealing with this. And so all of our emotional intelligence is taxed right now. So just realize that in addition to our own stuff, we're dealing with stuff, we're isolated, we've got all this stuff going on. We also have this massive universal experience that none of us know what to do with. So being empathetic, having grace, having kindness, forgiving those who lose their stuff on you, because they're gonna, and forgiving yourself for losing your stuff on others, because you will. It's just where we are. And so grace and forgiveness is my parting word.
Perfect. Thank you. Jim, anything, recommendations, any place folks need to go visit, other than insurers.org? I throw that out there.
Yeah, absolutely. So a lot of great resources on the Big I website and the Insurers of Tennessee website to keep updated on new legislation about liability protection or guidance or anything like that. Check the Big I website. The Tennessee Pledge website as far as guidance on how you should be cleaning and operating your business in light of COVID-19. Again, I think to kind of rehash what I said earlier, those are guidelines, but with all the negligence discussion and liability claims, they really should be taken seriously. So I would urge you to go there and also connect with the Tennessee Chamber and your local chambers too. Have a lot of great resources there for your business.
Perfect. Thank you again to Claudia and Jim for being here. We appreciate it. I know our members appreciate it. And we will continue to try and bring the most up-to-date information we can as we get it. Thanks again, everybody, and have a great day.
Thank you. Stay safe.
Bye.